In the context of, when was the first time you realized, could this be imposter syndrome?
I don't think I ever knew what those words meant until just recently, but
you had, but
the
when
vibe of what imposter syndrome is, yes.
Okay.
Because, like every day of your life, right? Like, why am I here? I don't deserve to be here. What did I do? I'm not smart enough to be here.
Is this, I don't know, these words, right? Yeah. Like I'm almost like in a way of like you start second guessing yourself because someone else is questioning you or, whatever. You know how great you are. These women up here, y'all know how great you are, but then like someone starts questioning you or like, you're like, is it me? Am I, do I really know? And then you're like, you have to get back to yourself and be like, yeah, of course I know. Of course. But yes, I've had those moments. I can't think specifically of those times, but there's certainly been times where I've had to second guess myself or double check myself on something, even though I know what I know.
I think we have all been in practice. How many years have you been in practice? 10, 11? I've been in practice 11 years. So I think we're all about the same. I think the point of what I'm trying to say is like we've all been in practice for some time to where we kind of, sometimes those feelings are
they normal now? Is the abnormal normal?
You're right. But I do think with experience, you get more confidence. Mm-hmm. And I think that we often forget what it's like for students and for residents that have those experiences, to have those feelings. And it's normal because, I can think of one of the first cases I did as a neurosurgery attending. I think I said this in our last podcast, but I got in there and I'm doing the surgery and I'm like, I don't know why they are letting me do this. I'm like, went home and I thought about it and I'm like, well, I either quit now and waste like 16 years of my life that I spent getting here, or I just realized that this is me doing it and I'm just going to have to figure it out and to be confident that I'm supposed to be here. And so those, I just think that normalizing this conversation, and particularly as it relates to students and trainees, that we've all been there, even though the three of us up here exert the confidence and strength that comes across when we talk to people, when we talk to patients. It's all because we have had years and years of experience to know when we've had something go wrong or differently, or we thought about it and when we learned from mistakes or things that we wish we could have done better. And so you get better as you get more experience in certain things. And yeah, I just think it's important to know.
Dr. McDonald, what does support look like in medicine for imposter syndrome? Like, if we're trying to create education or curriculum around it, what does support look like? Like, what does support look like? Like, how do you speak to this? Because I didn't know the words until I read the definition. And I was like, well, I didn't know what that was, but certainly.
And changing the environment that our trainees are in.
Like what?
Seeing more women of color, seeing people that reflect our, where medicine is going as far as providers go, is helpful to address this idea of imposter syndrome.
Because they're seeing it.
Because you're seeing it. You're seeing people who look like you, who are doing well and being able to, competent and trained well and things like that. I think this idea of imposter, feeling like you're not a part of, is, there have certainly been times where I've sat in spaces where I look and I look to my left, I look to my right, and I say, where are the other people who look like me within there? Why am I here? Is there someone, where's everyone else?
Yeah.
Mm-hmm. And so seeing more people come to the table of medicine who reflect me helps with that, eradicating that feeling of, do I belong?
Yeah. I think you brought up a really good point when you were talking about, I look to my left, I look to my right. I don't think that there's a very good understanding of what DEI actually is. Imposter syndrome is a part of diversity, equity, and inclusion. And imposter syndrome, most of the people who talked to me about our conversation were not even physicians. they weren't even physicians, and they were talking about it from either the corporate world or even just with life. Like, I will say, imposter syndrome for me, it doesn't just span healthcare. It just spans, me being a mom. I'm like, what?
Yeah.
Somebody's let me raise this child. Like, I didn't. Yeah. Somebody checking on me.
Need a manual.
It's all those kinds. It's all of those. It's all of those aspects. I actually do have a story, and I literally was at the head of bed about to intubate somebody, and it was a very tenuous situation, and I ended up calling one of my colleagues who is an anesthesiologist, who that's all they do is intubate, really, anesthesia critical care. And it was a very young patient, pregnant, and I took one look at her, and I was new. I was new. Actually was here. I was new here, and no one knew me or anything. And, I walk into the room, and they call me, and I come down, and I know immediately that she needs to be intubated. And I know immediately that, it needs to happen. And the room shifted. I was like, okay, we need to intubate. Well, we're over on L&D, and they're like, well, and I was just like, it's okay, we can do it here. And it's because of the tenseness, and, they're just not used to that level of sick like we are in critical care.
Yes.
Freaking out. Well, she wants this, and she wants this, and, so then, and it wasn't about me. It was just about the feeling in the room was just like, oh my gosh, well.
You could feel that tension.
Yes.
And you were didn't know them.
Yes. But I knew. I came into the situation saying, okay, and he'd even had in my mind my plan A, my plan B. If it doesn't go well, I know she's pregnant. So, like, I'm thinking about physiology. I'm thinking about all these different things. And the second I feel that shift in the room, but what I did was, instead of just taking myself out of the situation, I put my back up. I called my colleague, and I was like, you know what I'm going to do? I'm still going to do this, but I'm going to have my backup. Because at that point, I did need a little bit of confidence boost. And all my colleague did, shout out Dr. Bailey, all he did was walk in the room and go, all right. And I was like, hey, this is the situation. And he's just like, okay. And he looks at me like, so I do it. Everything's seamless. It's fine. And so you're right. It was the shift in the room that made me be like, ugh. But it was my colleague who came and gave me that validation, like, you got this. I actually see.
And he didn't have to say anything. It was just present, and it's all right.
Yeah.
That's it.
Literally. Yeah. And that, that was all I needed. And so when I talk about support, sometimes it's, again, for us to talk about this and then say, like, it happens. Like, this is what happened to me. Because, again, making things abnormal that need to be called abnormal and making things normal that need to be called normal. And I think that for imposter syndrome, I think it's a very normal thing that everybody goes through, not just in medicine, but in different aspects of their life. And so us talking about it, first of all, just talking about it, figuring out what putting a name to what we actually feel and what's actually being experienced, I feel like is the first way to say, well, these are the things that we can do about it. And from my standpoint, the thing that I can do is continue to just share my story and say, it doesn't matter that, this is who I am and these are my credentials. Yesterday, this is what I felt and this is what I experienced this morning. And so people are like, wow, I'm like, yeah, I may, seem like, you got it all together, but it's kind of like when you're a physician, you're like the pilot, right? If every time you hit some turbulence, the pilot comes running out the cockpit, like, you'd be freaking out. But like when you hit some rough air and you don't see anybody, the flight attendants, and there's no overhead from the pilot, you're like, oh, we're good, And so I kind of look at our roles in these situations as that, like, we're kind of the face in the room of like, all right, well, this is either going to go okay or it's not. And so keeping the conversation open and being very intentional about how I show up, to your point, about with residents and with medical students, because I think our experiences and the things that we talk about specifically around this will give people, I think people will kind of relax and be like, oh, okay. So this feeling is actually a normal feeling. It is, but what can we do about it? Those are some of the things that I hope that our discipline continues to talk about, along with mental wellness, because I think this is one of those things that definitely affects your mental health and wellness.
Yeah. What I hope, though, too, for our trainees' sake, once you invest the time into your medical training and go through this process, I hope, that truly people recognize, though, that their own worth and that the investment that they've made, and really show up to places knowing that, this idea of you do belong. Yeah. You absolutely do belong. And you deserve it. Despite, because at our last time we talked about this, I said, a lot of this idea of imposter syndrome is actually other people imposing that feeling on you that you may not belong, or you may not know how to do it, when you absolutely know within yourself that you can. Mm-hmm. So, this idea of showing up and saying, absolutely, I am well trained and I know I can do these things, and continuing with that messaging and showing up and doing, then just, creates that environment that then people get buy-in. But again, you already knew what you had inside, and I hope our trainees recognize that too.
Yeah, that you worked hard.
They possess
and you deserve.
that. Yeah.
And it's not about knowing everything; it's about knowing your limitation.
Mm-hmm. That's also
and when to
sign of strength.
And when to ask for help, and when to have that the confidence to
make the decision.
To make the decision. And I think to the last point, probably before we close out, is just talking about, to April's point about knowing your self-worth, but also knowing that you bring your own person and your own self, your authenticity to the table. So just because I turn to my right, I turn to my left, and these people don't look like me, doesn't mean that I don't deserve to be here. Will I be sometimes feeling different? Yes. Is it because they are thinking differently of me? Maybe, but I am imposing that thought on myself because I am judging myself because I think that I don't look like them, so I don't deserve to be here. And that's not true. And I think especially for those people that are out there in a certain dominated field, like, male-dominated specialty or whatever the case may be, to know that you've worked hard to be here and you deserve every second of it, and your voice is just as important as everybody else's voice, and just to be you. So
love it. I couldn't have said it any better than both of you guys. So on that note, I want to thank you for joining us for this segment of our Women in Medicine, Diversity in Medicine podcast, where we talked about imposter syndrome. And as always, we want to hear from you. We want to know, what's your experience? What are some things that we could talk about surrounding imposter syndrome that would help you guys? So please like, comment, share, and subscribe to our CME channel. Also, do not forget that you can get CME credits by answering the 3 questions in the video. All right, we'll see you next time. Thanks. Bye-bye.